When most people think of jaw surgery, they think of it as something only for extreme medical cases. But what if I told you that corrective jaw surgery, also known as orthognathic surgery, is not just about fixing bones. It's about restoring balance. It's where science meets symmetry and where function meets confidence. I'm Dr. Vikram Singh, oral and maxillofacial surgeon, and in this video, let's discuss about why corrective jaw surgery matters, because it's one of those rare procedures that improves how you look, how you feel, and how you live. Let's start with function, because this is where it all begins. Some people are born with jaws that don't align properly. Their upper jaw may be too far back, the lower jaw may be too long, or the bite just doesn't meet naturally. This isn't just a cosmetic concern. It affects chewing, speech, breathing, and overall oral health. You may be surprised how many people suffer silently, struggling with digestion because they can't chew properly, living with constant jaw pain, or developing sleep apnea because their airway is compromised. Over time, this misalignment leads to tooth wear, TMJ disorders, and even chronic headaches. And no amount of braces or cosmetic dentistry can fix the underlying problem, because the issue isn't in the teeth. It's in the position of the bones. That's where corrective jaw surgery comes in. It allows us to reposition the upper and lower jaw, not randomly, but based on the detailed 3D imaging and facial analysis. The goal is to create a natural, functional bite, and in doing so, we often transform the entire face. Which brings me to the next benefit: aesthetic harmony. One of the most powerful effects of jaw surgery is how it improves the overall balance of the face. A recessed chin becomes more defined, a gummy smile becomes balanced, a long lower face becomes proportional, and this isn't about chasing beauty standard, it's about restoring facial symmetry that nature may have disrupted. Patients often tell me that they finally feel like themselves in the mirror. It's important to say this: corrective jaw surgery isn't plastic surgery. We are not altering identity, we are simply moving the existing bone structure into better alignment. And when the bite is right, the face naturally looks more harmonious. Jaw misalignment is not just a matter of discomfort, it can impact breathing. Many patients with obstructive sleep apnea have jaw positions that restrict their airway. By bringing the jaw forward, we open up the breathing space, reduce snoring, and in many cases, eliminate the need for lifelong CPAP machines. The confidence that comes after being able to speak without discomfort, to eat without pain, to smile without feeling self-conscious. And now you must be wondering, what does the surgery involve? Corrective jaw surgery is performed under general anesthesia, and the bones are adjusted through incisions made inside the mouth, so there are no visible scars. Titanium plates and screws are used to stabilize the bones in the new position. Recovery takes a few weeks, with swelling gradually subsiding and diet transitioning from liquids to solids over time. Braces may be involved before or after the surgery, depending on the case. And yes, it is a commitment. But for the right patient, it's life-changing. If you've been living with jaw pain, bite issues, facial imbalance, or breathing problems, and if traditional dental care hasn't helped, maybe it's time to look deeper. If this video helped you understand the true purpose of corrective jaw surgery, not just for looks, but for function and health, please share it. Someone else might be silently living with a problem that has a real permanent solution. Because changing your bite can change your face, and changing your face can change your life.
Subscribe for more content.